what's cool, I'd love to pick your brain a bit, Dr. Fogel, on like how you see people's changes in your practice. Like there was a point where you really started to take on functional medicine, and not that you didn't from the start, but like I know that when we came and were interning in your practice, you started to really ramp up the functional medicine in conjunction with the chiropractic. And what was the difference in like healing time and the results, like disc hydration you would see, or, what were the significant changes or maybe stories that stood out to you as you started to really implement this?
I used to keep them separate because I never really wanted to kind of sell anything to anybody. I mean, I always believed, like when I was in chiropractic school, I used to read functional medicine things all the time. There was I think he was a doctor or a PhD. His name was Ray Pete. And I used to read his newsletters, and I read Sherry Rogers, all her books on, what your cardiologist isn't telling you, and Detoxify or Die. And I'd read all these books in the back of classes that were boring to me, and I feel like they were like really going to be applicable to like my type of practice, There were a lot of classes like that, but there were a lot of classes that were awesome. And so most of the classmates, would be making fun of me. Going, why are you reading that stuff? That doesn't apply to chiropractic. Because, we were in chiropractic school where we felt like it was the best profession, and all you need to do is adjust subluxations and you were going to cure the world, I mean, that's not fired up. But I believed in that model, but then I believed in adding in things that I just felt like my mentors had taught me. And then I was going to, functional medicine doctors. They weren't called functional medicine doctors then. They were called more applied kinesiology doctors, right? That incorporated nutrition and things like that into chiropractic. So I never really wanted to kind of convince anybody of anything. So if somebody was curious, then I would, try to educate them. And then I would, have their blood work sent out, and then I would, interpret it and consult with them.